The views and opinions expressed on Scrubbing Up with Dr. Michael Kachmar are those of its host and guests exclusively. They do not represent any entity, organization, or municipality.
Hello, everyone. Welcome to Scrubbing Up with Dr. Michael Kachmar. He's a surgeon. He's a 100-ton boat captain. He's a lieutenant on Seaside Heights Beach Patrol in New Jersey. He's a member of the Coast Guard Auxiliary. He's Dr. Michael Kachmar. Need answers to your medical questions? We have them. Listen in to hear latest on medical topics related to all that and more.
Hello, everyone. This is Dr. Michael Kachmar. Scrubbing Up with Dr. Michael Kachmar.
Yeah.
We have, wait. Today's date is January the 28th, the year of our Lord, 2022. And we're getting ready for a big snowstorm. Jeremy's, we strapped on the plow to Jeremy's car.
Yep.
So say hello, Jeremy. You look a
How
little
you
dark
doing,
today. You look
everybody?
dark.
Yeah.
Why do you look so dark today?
I
You
don't
look
know.
dark. I don't know.
You got a tan.
He's got a tan. It's the camera angle. Sometimes these cameras act up on us. So anyway, so say hello, Jeremy.
Hey, everybody. How you doing? I'm your old pal, Jeremy. You know me.
Right. And we actually have a guest today in the studio, and this is Sean. He's from our lifeguards off duty.
Howdy.
And he's got a project for his class. He's got a interview a doctor with regard to corona.
Sean's part of the family.
Right. So
Howdy.
we're bringing him in. So anyway, I'm Dr. Michael Kachmar. I'm a board certified reconstructive foot and ankle surgeon. I'm on staff at multiple hospitals, Jersey Shore Foot and Leg Center, Southern Ocean County Hospital, Monmouth South, Community Memorial Hospital, and Thomas Jefferson University.
And if you're local,
So-
if you're local and you're in the hospital and you got something that's going on from the knee down, like you got a wound, you got something going on, you can ask for Dr. Kachmar and they will get him.
They might
for
not get you, but they may not give me. But if they don't, then you call me up.
Yeah.
So give them the contact information. People on the podcast, you could get us on drkachmar@icloud.com.
Right. Yeah.
Where else,
And,
Jeremy? Go ahead.
we're on Yahoo. We're on Spotify.
No, but the contact, like if jerseyshorefooandleg.com.
Jersey Shore. You just said it.
No, jerseyshorefooandleg.com is the web page.
Jersey Shore Foot and Leg
Center.com
Center.com is the webpage.
And then the email address, if they want to email us, is
Dr. Kachmar. That's DRKACHMAR at iCloud.com.
.com. Great. So, and you can always call my office 732-269-1133. I'm a practicing foot and ankle surgeon, doctor of podiatric medicine in the New Jersey coast. And what are we going to say, Jeremy?
We're also streaming on Facebook. We're streaming on
Right.
YouTube.
Right.
When on YouTube, please subscribe and click that little bell notification that lets you know when we are going live, and so you never miss an episode.
Right. And Jeremy and I, we're thinking about maybe starting a company, fix transmissions and mufflers, right, Jeremy? With a side show.
That's all I need.
That's all I
yeah.
Jeremy,
Yeah.
who's going to be the muffler guy and who's going to be the,
Yeah,
the transmission guy?
I know you get in the car and one of the pedals down below makes it go vroom. Vroom.
Yeah.
I don't know
Okay.
nothing about
So,
that.
so the other thing is we are on Rumble for everybody who is interested. We just started that. We're not on Rumble. Actually, we're on Rumble with the Lifeguard show. We're not on Rumble with this one, but we're going to get, that's the next step. So we'll be on Rumble
So
here.
we're not on Rumble.
No, not this one, but I am on Rumble with the Lifeguards Off Duty. And that's another thing. Follow us on Lifeguards Off Duty with Dr. Michael Kachmar. It's a great show. Also, it's once a week. So we do this show every week, Friday, and here we are today. We have a lot to talk about. Of course, you know, the corona thing is
That's
just
still going on?
Oh my God.
Oh,
Oh my
come
God.
on
Oh my
now.
God. Oh my God. So what I want to talk about a few things about corona. I mean, we could go on and on about,
Right.
you know, we've been very consistent about vaccines and who should get them. And, you know, I think that it, you know, they definitely work, no doubt about it. My pet peeve right now is with the monoclonal antibodies.
Yeah.
And really when we talk about that, it's called multi-drug sequential monoclonal antibodies. And what that means is they had about 8 drugs that they could give you. They give you an IV.
Yeah.
They give them sequentially. So they give you one and in the same time, you know, right after that, they give you another one. Usually you get 2 drugs at the same time. And they were very effective. And the FDA CDC, the FDA approved it. It's FDA approved for treatment of corona.
Yeah.
Okay, and then we're going to talk about that in a minute. What
I don't
that
know
means.
if there's any black market monoclonal antibodies out there,
Nah.
but you should know it's only a certain type of monoclonal antibodies that's actually going to work for you. So you got to make sure you're going through the legit ways to get it.
Right. So what happened was when Omicron came around, some of the monoclonals were not effective. And right now there's maybe only one. But the thing is, I'm criticizing the government. They could have made more monoclonal antibodies that were effective. It's very easy. So,
No, but they grabbed it. It was like mine.
Well,
and that's
right. And there's two things you got to
that's not
understand.
cricket.
No, there's two things out there. You have antiviral and antibodies. So you have monoclonal or antibodies, which are basically they make this. It looks like a Y molecule, and it's an antibody that goes after the corona. It's an antibody.
Right.
The other, so it clicks onto it, it grabs it, and basically it's like me I'm you're a linebacker. I mean, I grab you and I tackle you
like a bear hug.
a bear hug. I grab you.
As a mechanic.
No. Well, that's nothing.
Right, no,
so I grab you and I knock you down.
Yeah.
The antivirals that they're coming out with now, Pfizer, that actually goes in and screws up the virus as it's replicating.
Right.
That's a little different. So there's different. I don't want to get into that. It's a whole big thing. But the monoclonal sequential are so good, and we don't have them. Nobody could get them now.
You can't prescribe them or anything.
No, there's none. Nobody got them. They ran out of them.
I wouldn't even swim in that. Like with all the doctors out there that are getting crucified for.
Yeah, that's a good point.
Yeah.
No, the monoclonal.
I would not swim in those waters.
Answer your question, Sean. The way the monoclonals work is that people will go to emergency room, and with symptoms of corona, there was a criteria. You had to be 65 and older and have comorbidities. It's changed. It's in different states and different places had different criteria. But I remember at the hospitals around here, you would go into the ER, you'd have some difficulty breathing. They would put you in a tent across the parking lot and give you, infuse you with an IV, put an IV in, and give you monoclonal antibodies. I have personal stories of patients that I sent that turned around in 12 to 24 hours. Yeah. I mean, miraculously turned around.
It works. There's no doubt about that.
So why don't we have it? Why isn't it all over the place?
Why isn't it? Well, why aren't there other treatments? Why is it just,
Okay, so good thing you asked that question.
Yeah, why is it just...
Tell us.
So I hear the news, and I hate when I hear this, on the news. Like, and the big thing is
vaccine or bust.
Well, they go in after Joe Rogan and other people and talking about, and the Dr. Malone and this guy, Dr. McCullough. So they're talking about FDA approved. So the two of the medications that are very controversial,
right,
are hydrocodone, which is Plaquenil. Hydrocodone has been traditionally used for arthritis, and then the other one is ivermectin, which has been traditionally used for infections, I think, of worms and stuff like that. So you have these two medications, and
AstraZeneca.
There's other ones. But these are the two that I want to bring out because these are the stars right now. Everybody talks about them.
Sure thing.
I think if you go up to a corner in I don't know, New York City, on any corner, and ask some guy, even a guy with a cup, and say, "Hey, do you know what ivermectin is?" He probably will. He's like, "Hey,
I got it in this box.
Yeah. He
could probably VHS tapes.
Yeah. You could probably buy this stuff black market too. That's a good point. You can, but on the news they say they are not FDA approved to treat corona.
Right.
Okay, and then a lot of people say, "Well, they're not FDA approved drugs." Well, that's not the case. So let me go to our famous whiteboard. Okay.
Oh.
Okay. So so what is
whiteboard.
and the people who are listening to podcasts, I'm going to read this out, but I want you guys to go to our the people who are on your podcast, go to our YouTube channel and look at it under Scrubbing Up with Dr. Michael Kachmar.
And
you can see
Facebook, you can see it as well.
All right. So what does FDA approval mean? So means that data on a drug effects have been reviewed by CDER. That's the Center for Drug Evaluation Recommendation, by the way. And so it's a separate company, so a separate entity. And that the drug is determined to provide benefits that outweigh its known and potential risk for the intended population. That's right out of definition from the government. So a couple things right there. So that means that the drug has gone through rigorous 4-phase years of evaluation.
Oh hell yeah.
Years, and
Yeah.
and it's the CDER, which is the Center for Drug Evaluation and Reporting, whatever.
Yeah.
That's they have their own set of criteria, and then they'll determine, right, that whether if it provides benefits that, now listen to me, not outweigh, not a complete, it's known potential and potential risks for the intended use. So in other words, it's still going to cause problems.
So here's my question.
So that's a normal drug
No,
that's
no.
approved.
I dig it. So here's my question to you. You got all these government agencies and stuff,
Right.
watching,
Right.
running these vaccines through like a strict boot camp
Right.
before they're allowed into the public. Why haven't we found out any information about our current vaccine?
Because it didn't go through this process, so it's not really.
No. But there has to be studies going on.
Yeah, but you don't.
2 years
You're not required, and we're not required. The federal government is not required to tell us everything, and they don't. There's people who are submitting FOIA, which is Freedom of Information Act, to get this information. The reason why we don't have it, and we're not, what's the word I want to use? Obligated to have it, is because it didn't go through this. It's not FDA approved. It's under emergency use. These drugs are still under emergency use. That doesn't mean that they're bad. I took the booster.
But
you understand? You're making what you're saying is you don't understand why we don't have it. The reason why we don't have it is because it's not FDA approved. If it was truly FDA approved under this criteria, the vaccines or any drug, you would know it would be out in a package insert. Show me the package insert.
I understand what you're saying, Mike. I do.
Right.
I do.
But what
I'm saying is they've had 2 years right now.
Right.
Okay. So how long is the normal length of time to study? Because they should have been starting the FDA.
It could be like 5 years.
approval.
It could be 5 years.
Oh,
years.
wow.
It could be a long time. You got to go through a lot of people. Listen, I'm not saying,
and I'm only saying this. I'm not saying this to just to play devil's advocate against you or anything like that. I'm saying it because I'm responding to the fears that people have out on the street. The unknown is the birthplace of fear,
right.
And that's what this whole thing's about. We could talk to the end.
Right.
Of the
Well,
earth,
let me
the vaccine they're mandating us to have.
Right. Let's not get off topic, because I want to specifically make the understanding and to discuss the topic here at hand, and that's the confusion between what drugs are FDA approved and not. And so so let's just hold off on the vaccine. So we're talking about these 2 drugs right now. So any drug that's FDA approved has gone through this rigorous process, and they have decided that they determined that it provides benefits. It provides benefits.
Is the vaccine FDA approved?
No, forget. That's another subject.
Okay.
Don't go off on that yet. We'll hold that thought.
I'm waiting on it.
Hold that, because you're going to get me. I just want to talk about any drug, a drug that now is out there. The benefits are provide benefits that outweigh its known and potential risk for the intended population. Okay. There's a couple things there I want to point out. Outweigh, which means it's not completely safe. The benefits, it's what the lesser of 2 evils.
And then intended population.
Exactly. Another big one. Old people, young people. Actually racial, there's people that react differently to certain medications, different subpopulations. It's very, very complicated, but okay. That's what drugs are. Okay. Now there's another thing. What happens, and this is called off-labeling. I want people to understand this. This is very important. Off-labeling. So what does off-labeling mean? Off-labeling is prescribing when a doctor gives you an FDA approved drug to treat a condition different than your condition. Now, I know it sounds, but think about that.
No. So what you're saying is to give you a treatment or a pill or whatever that was meant to treat
one
something
thing
else, but not what you have.
But right.
Gotcha.
So, and that is, now listen to me. Let me do that again. So off-labeling means a doctor or whoever's prescribing gives you an FDA approved drug.
Yeah.
To treat a condition different.
That was approved for something else.
It was a drug gives an FDA approved drug to treat a condition different than your condition. Okay. So in other words, the drug treat a condition different than your condition. The FDA approved it for one condition, say arthritis, and I'm going to take that drug and give it to you to treat you for corona.
And off-labeling is allowed.
Right up on top. Practice is legal and common. In fact, I did a little research. In the United States, about 1 out of 5 drugs are off-label prescribed.
Mm.
So they're given to a
Wait, but is this for corona? Like, are they doing, because
No.
It sounds to me like this is the sort of stuff that's getting doctors into trouble.
Okay, so that's why I'm bringing this up. So let's peel this down. Okay, so now what I'm saying is this. This is why there's so much confusion. Off-labeling is I'm taking a drug, okay, and we'll give you the one, which is the hydrocortisone, which is Plaquenil. That's the trade name. So that's the one that President Trump tried to push. They had like 300 million doses ready. That's an FDA approved that. Listen, hold up.
Yeah.
FDA approved that. That's an FDA approved drug to treat, among other things, arthritis.
Right.
Thousands, maybe millions of people have been on it for, it's been around for 60. I know personally, my mom was on it for 30 years, 40 years. Okay.
Hydrochlor.
Yeah. It's Plaquenil. It's for arthritis. I prescribed it many times for patients. Now, somewhere along the line, somebody decided or figured out that it could be beneficial treating corona. I'm not going to get into the argument whether or not it is or isn't, whether or not the studies say it is or isn't, but I should have the ability as a physician to off-label that like I do any other drug.
Yeah. From your professional opinion.
Yes, and give it to a patient.
Yes.
Now, you could sue me for malpractice. The federal government, you could get it. The state board of medical examiners could say, it's too dangerous, but it's FDA approved.
This is an FDA approved treatment, right?
Right.
So this has been fleshed out as to what the what do you call them, the side effects. It's all been fleshed out. It's safe to take.
Forget it. Yes, it's been safe for these. And listen, there are side effects of hydrochloride. It could affect your heart. You have to, if you have a certain kind of arrhythmia, it's an elevated T wave.
Yeah.
But here's the thing. I want to just finish this point. Same thing with ivermectin. It's a FDA approved drug. Okay, but the doctors who are giving it for corona are off labeling it. This is the first time that I've ever heard or seen where state governments, who give you your license to practice medicine, and the federal government and the World Health Organization has said, we don't approve it for corona. And if you prescribe it, the state boards are going to take your license away, or they won't let the pharmacist even fill your prescription.
Right.
Now, I'm not saying give it. I'm not saying it works. I'm not saying it doesn't work. The drug has been FDA approved. If you want to know what the side effects of ivermectin are and hydrocortisone, you could go into the package insert, go on the FDA website. You can find out. You'll know. And then if you want, normally we would be able to give it. Now, I am not allowed, right, or I shouldn't give a non-approved FDA drug or device. I go to jail if I give a non-FDA approved drug to a patient, and they have to sign on it and say it's okay. I think you could do it, but if you don't, you go to jail. Now, what is not FDA approved? I can tell you right now. Go to the drugstore right now, whoever's listening to me, and go buy one of the home tests for corona.
Right.
The quick test.
Oh, yeah,
right.
I took that. Yeah.
Look at the back of the box.
It's not FDA approved.
It says not FDA approved. What does that mean? That means that it doesn't. It means that it don't count. It means that it doesn't. There's no testing. There's no approval. It didn't go through the process. And so here's the thing: how can a drugstore sell a non-FDA product to the population where we can't?
Well, it's under that emergency
exactly
thing, yeah.
And you asked me about the vaccine. Is it FDA approved? Not in the true sense of the word. Just like these home kits, under the Emergency Act, they felt that they have enough evidence to say it's safe. Now, I'm not saying that the vaccines are not safe now. I'm not going down that road. I took the booster. I think if you got, you should get the vaccine.
And I think most of us know that it's not FDA approved, the vaccine. Okay?
Well,
most of us know. Hold on. Just bear with me. Okay. Most of us know that it's not FDA approved. What we're more concerned of is there a continual study? We don't even know.
No,
that.
there is. There is. There's a lot of people.
We don't even know that.
No. But you don't. I follow. I mean,
when
no.
would be the time?
No.
Will we ever find out
Yes.
that it's FDA
Yes.
approved?
No. It will be FDA approved when the evidence shows that what? When they get enough evidence and they show that the effects have been reviewed by the CDER and that the drug is determined to provide benefits outweigh its known and potential risk for the intended population.
But you know
understand?
what?
But here's
they may not, and I appreciate what you were saying. They may not be able to or be allowed to say anything. But if we had about further information about the vaccine, but if we had a government system that was more communicative to the public and talked, I mean, like Obama 27 times he actually had to go on air during his thing and talk about emergency stuff and answer questions. See, that's the problem. And that's where the fear comes from, is the unknown. Nobody's answering questions. Nobody's answering them truthfully, and lies are being caught. And unfortunately, it all wraps up. So do we believe this is, the vaccine's safe? That's where the fear is. Whether it's FDA approved or not, I don't think most people even, care about that. They're more worried about, is this vaccine safe for me
right
now,
well,
even under emergency conditions?
Right. Well, to answer that question, I'd say, and we're consistent on this show, is this: it's the benefits outweigh the risk. If you're 65 years old, diabetic, asthma, I think the vaccine is safer than getting corona.
Yeah.
But that's my judgment. Now, if you're a kid who's 5 years old, is the vaccine more dangerous than the corona? I tell everybody, listen, I don't know. We what the hell do I know? I'm a freaking foot and ankle surgeon. But what I do know is this: I'd go talk to the pediatrician. I'd go talk to my priest. I would pray to God. I would ask, Christ. What? And also I would look at as much as literature as I can.
Right.
But nobody knows. See, here's the thing.
And that's where we are, Mike. You're right. You're 100% right. That's where we are. We have to take responsibility for our life right now. What we do, get the information from everyone, from our priest, from our pastor, from whatever faith you have. Talk to people. Talk to doctors.
What I don't like is, what I agree with you is, I don't like when a guy like Joe Rogan is being criticized for bringing on people who are criticizing the main idea. It almost reminds me of back in the day when, was it Galileo said, the earth is round.
Yeah.
Listen,
that quack,
maybe this guy, Dr. Malone, and maybe Dr. McCullough, they're right or wrong. These guys are preeminent individuals. At least, listen, the whole idea when I went to college is you had debate. You sat there and you talked about it. I don't care, I had arguments with people who only last year, 2 years ago, they tell me the earth's flat. I'm like, dude, the earth's, but I didn't like, have them arrested or shoot them or beat them up or call them a scumbag or anything like that. That's their opinion. My point is that, two things here is we need to get down the rhetoric, and we don't know yet, and time will tell. We'll know eventually. The truth will eventually come out, what it is and what it isn't.
Yeah.
I can tell you right now, I took the vaccine. I had antibodies afterwards.
Mm-hmm.
I still have questions about, is it worth it? Is the risk worth it in a child? I don't know the answer to that. And the other thing is, if you had the virus already and you got antibodies, do you really need do you need more shots? I don't know that either.
I argue against the grain all the time. I know.
Yeah, you're a little bit of a conspiracy therapist.
I am guilty of it, and
there's a picture of you, by the way, in Bert. Was it Bruce, the Avenger out of Scotland or whatever? He's like,
oh, it looks like me.
Yeah. He was like, he went after the crown and everything.
No, but I do. I know I'm like that, but
it's okay.
I also believe that you should have the right to make your own decisions. I don't say you shouldn't get the vaccine. If you have comorbidities and you're worried for your life, my God, get the vaccine. Okay. I just argue for your right of choice, and that's it.
Right. Well, that's why we say we don't like the mandates. I think that's been a problem in this country.
Yeah.
because
you remove choice. This is not the land of
right,
the
right.
free anymore.
If you go back to the CDC, this is what I'm saying here. We don't even have this. But even if you have a drug that's approved, it says provide benefits that outweigh its known and potential risks. There's no medication that is completely without risks. There, I mean,
that's the stuff they speed through in the commercials about these medications.
Right.
Like, some sudden eye bleeding may occur.
Right.
You know,
What were we
we're,
gonna say,
we're,
Sean?
we're so worried about COVID that like it could kill people, they could go to the hospital, but these drugs are already FDA approved. Is like your whole point with the whiteboard. This ivermectin, the hydrochloroquine.
Yeah.
Like you're not going to go to the hospital for taking a prescribed amount for your body.
We've also got these medications to be used in with the vaccine, but nobody's using it. It's just vaccine only.
But
when these other ones do work.
Well, listen, there's some studies coming out say that hydrochloroquine works, and Trump, his administration had about 300 million. But here's the thing, Sean. There are downsides to those two medications, but theoretically, if you're going to be getting from a doctor, he or she will know to make sure that it's not the highest risk, because it can interfere with other medications.
And also, their neck is on the line too.
Well, but
this is safe for their patients.
Right. You could get an EKG. The treatment initially for corona, when it first came out, was and the doctors were giving it a Z-Pak, which is an antibiotic, and which is for about a week, and then also hydrochloroquine.
And neither of these are going to put you in the hospital. Is like
no, not if you don't have a heart arrhythmia. Now, both of them could cause heart arrhythmia. So if you could get an EKG before you got it, you can monitor it. But for the most part, that's not the case. I mean, again, nothing's 100%.
Yeah, but with the monoclonal antibodies and ivermectin and all of these, the whole reason these doctors want to give these to their patients is so they don't go into the hospitals. They don't go on the respirators, and they don't go fill up the cemeteries. That is why they do this. But
Sean's asking,
telling them that they can't do what they know as doctors is right for their patients. That's just completely wrong. I don't know how you can see that's right.
No, but Sean, there's a lot of things here, and I just want to make sure our audience gets this point. Ivermectin, hydrochloroquine are FDA approved. They're not approved or indicated for corona.
Yeah,
but
you can off-label them.
But not now. This is the first time these two drugs are off limits to off-label.
Wow.
And that's scary, because what happens if we have socialized medicine in this country, and all the doctors in this country are told by the federal government, this drug, you can't use it for this,
and they can't use it, and that's that,
and that's it. Or how about this? You can't order an MRI, or you go to jail.
What's like another non-COVID issue that's going to be a part of? So a non-FDA approved cancer medication,
right? Cancers, that's a big one. Cancers,
we can't do any experimental non-FDA treatment for cancer.
Well, but even if it's you don't confuse it.
I don't
know.
I'm asking.
No, we don't give. We're not talking about drugs that are non-FDA approved.
Yeah,
I'm talking about a drug that's FDA approved to treat symptom A or condition A.
Yes,
and then we traditionally have, there's other studies come out, and we take that drug and we use it for something else. It's called off-labeling,
because we know it legal. It affects the lung or the heart, and we were trying to treat that in some capacity.
But I give you a great one, Viagra.
Okay,
Viagra was I think a blood pressure pill. They were experimenting, and they had these old guys that they were coming in going, holy shit, I've been bagging my wife 9 times a day.
Our entire audience just stood up to attention.
But that was an accidental, Viagra. So now, but then it became, Viagra actually, by the way, became Prozac was the most prescribed drug before that. And then Viagra came up. That was there's some great movies about Viagra and the drug reps who sold it. I mean, they were rock stars. Can you imagine being a drug rep? And you want to go in and give the doctors free samples, and they were giving their friends and everything. So you could, back in the day, that was the cocaine day. So you're drinking and you're cocained up. You couldn't get an erection. You take the Viagra. But my point is that
dealing that you don't stiff him.
Oh, no.
But what gets me, Sean, to answer your question, I want to point it out that this is very dangerous. Not only there's a potential here that a lot of people could have been saved, or they didn't have to be hospitalized. I'm not going to go down that road until I see the evidence. It's mounting. They just came out with another study, said that there's like a 60% decrease if you give hydrocodone like the first couple days. But I don't even go in that road. I can tell you what definitely works, and the FDA approves it, is monoclonal antibodies. And they're there. And why aren't we having it where everybody could get it? Why didn't we modify the stuff? It became political.
Because Papa Joe took control of them, and it's his playground ball, and you can't play with me.
And I got to say that is accurate. Somewhere along the line, maybe 3-4 months ago, you could get it. Any doctor could order.
They used to treat people in the tents with COVID.
Yes.
Wow.
Yeah.
They stopped. They're not.
Well, they don't. What happened is the federal government took over the distribution of the monoclonal. They said that there was a shortage, and then they started doling out. Now
they wanted to take control so they could distribute it at their leisure and not it just. I don't know.
Well, I'll take the devil's advocate
because honestly, and here I am burning the walls. It's better to. No, I'm losing my thought now.
Well, they said what I read the articles, and the federal government said basically the supply is dwindling, and we need to make sure it's used appropriately where the spikes were.
The mandates. Then he needed everybody to get the vaccine. That's why he held back the monoclonal antibodies.
Well, you're assuming that.
Well, no, I heard some people in government were getting treated with it pretty late in the vaccine usage or after the vaccine was implemented.
Well, listen,
when Kamala Harris got COVID.
Who?
Okay, Kamala.
Who's that?
Kamala.
Who's she?
Okay, when they call her the lemon now.
No, listen, don't get us shut off here. I don't know.
Okay. So when Kamala Harris had COVID, when Jen Psaki had COVID, tell me they didn't get monoclonal antibodies.
Listen, tell me if you want to really find out. You ask me what happened with the monoclonal. I would go and look at some of the clips on YouTube with DeSantis, the governor of Florida, and the allegations that he made.
Sean and I were. That's
he basically his assumption or thought is that they were using it politically and they weren't getting enough of it. But to answer your question, Sean, in the beginning, any doctor, any clinic, any hospital could order it from the company. In fact, I saw the company do a interview. One of the companies who makes the monoclonal, and there's about 8 of them, eight different drugs. I don't know, maybe 4 or 5 different companies. He said, "Listen, they're saying you get immunity for about 6 to 8 months."
What do you think is the confusion between doctors trying to prescribe these medications and like advocating to use them, and they're just no one's listening?
Well, it's interesting you asked that question because that's very insightful. But let me make a point. There was an article that came out maybe 6 months ago. It was in California. And this is before the monoclonals, really became a hot topic. They were all over the place. And the clinics were empty. There wasn't a lot of people going there. And this article I read, it was an interesting read because this is another layer where you wouldn't think. They said a lot of doctors didn't know about it. They were just like, you got a guy or a girl who's a busy clinic. If doctors are just like human beings, like everybody else. If nobody's telling them, they're not reading the journals, and they're just pushing people through.
Yeah.
They're telling people, go home, take an aspirin. In the meantime, this one article saying like, why don't you send the people to the clinics? Well, you got, the problem is you got to educate not only the public, you got to educate the doctors. My darling, she's a drug rep. These companies spend billions, millions and millions and millions of dollars to send these drug reps into the doctor's office to explain to these guys and girls why they should be doing this drug or that drug. Why do they need to do that? You ask me. So what? But here's the thing. Well, yeah, but how about this, Sean? How about maybe
they're usually very attractive women.
Yeah. Well,
yes.
Yeah. Hey, that's listen.
No joke, man.
Listen,
I've seen them come into the office, and I'm like,
listen. If you get,
they pick their reps very well.
Listen, Jeremy, who you get a beautiful 22-year-old darling come in your office and bring in your lunch, or you got this.
Yeah.
Jeremy again.
You guys want this thing? Huh? We're lousy with them.
I tell you what, though, it's funny you talk about they get really good-looking girls. And the guys too, like they're models. Like I get them come to my office, and I'm like, look, even me, I'm like, I'm not gay. I'm like, this guy, like he's too good looking.
Groomed.
Oh yeah,
I don't even know. Like I got this scruffy beard. These guys are like they're drawing
Jeremy-
their beer in every
Jeremy could
morning.
be a Harvard grad with the best credentials in the world. He'll never get a drug rep job.
Please.
They'll be like, "Hey, Jeremy, can you at
Please.
least wear contacts?"
I could probably wear a man's ear.
Yes.
You know,
But my point is that
a bro.
yeah, bro. The point is that what was I going to say? The FDA approval on the monoclonal antibodies was a long time ago. It's indicated. It's bulletproof. It's been around for a long time. It's indicated and approved for pregnant women. So my point is, if you've got if they really were concerned about ivermectin and hydrochloroquine, saying, "Oh, it's so dangerous," okay, I'll give them that. All right, I don't believe that, but even if that's the case, then why don't you put your horse and wagon up to the monoclonal antibodies? And today you hardly could get them.
Yep.
So along with you again and other doctors who have been trying to use these medications, why do you think no one's listening to you guys try to say this is a problem?
I think that the resources were pushed.
It's more like because it's all been politically weaponized. We got on one side of the fence, we got doctors who do speak out, because when you take away their ability to do what's right, what they feel in their educational background and everything, their professional opinion for their patients, to do what's right for them, you take that away, all they got is their voice. But that's the same with people all over. People abhor a vacuum. Well, if you take away what they can do, they will respond out in some way, sometimes violent. I wish it wasn't so, but sometimes all they have left is their voice. And there's a lot of doctors out there that are speaking out against it. A friend of ours, Dr. Stephen LaTulip, he had his practice, his entire practice. That's his life. That's what's putting his kids through college, taken away, just because he was prescribing these medicines to his patients.
Well, listen, here's the thing, Sean, to answer the question, is that I'm not a conspiracy guy, and I don't think anybody, I think a lot of it is policy. And, you have these big, the government is a big entity. So they want to push the vaccines. That's their bias. And they may not have enough bandwidth to push the other things, or they let it go to the side. You can only do so much. So I don't know. I think that if, what I read Peter Navarro's book, and they said that basically the model they had coming out was that they get the vaccines, right? Give it to the most, people who really need it, and then really try to double up on therapeutics and really work on that. That was the initial model. Of course, when the election came up, Biden and Harris were like, "I'm not taking that vaccine. That's not my vaccine." I remember I listened to it on TV.
Now they can't get enough of it.
So it became politicized, which is sad. And so now you kind of left with this thing where there's a lot of people in the United States who are not vaccinated. If you look at the statistics, a lot of them are minority, and a lot of them are, want to get it. We never said on this radio show not to get the vaccine. To me, I think it's another tool in its tool chest. But my only thing that I criticize,
you want to use all your tools in the toolbox.
Right. I'm like, look, guys, we got other tools to use in addition to this. Now, I got the booster. And when you talk about, where my position is, my first vaccine was December 28th.
Yeah.
I don't, how many people got any? So I was one of the first ones to get it. I wasn't the first person, and I treated Corona patients. Then I got my next one January, and I got my booster in August, and then I got my,
right away. My Dr. Mike was, he had to play it safe for his patients, and that comes first.
Well, I remember you were agonizing over it because you had people telling you don't get it, and I'm like, Jeremy, I'm not gonna tell you what to do. It's your life, but I can tell you. I think the benefits outweigh. I think the benefits of vaccine are you get Corona, man. And
I did end up getting it. I got it for my family. My wife wanted me to get it. My son. Okay.
Mm-hmm.
So I did get it. Is that turmoil?
Well, you got the vaccine. You got the vaccine.
I got the vaccine. I didn't get the booster.
But then you got Corona too.
Then I got Corona. So now I'm a Superman. I fight off anything.
See, I've known patients who got Corona, who had the vaccine, who didn't get the vaccine. Anyway, let's just finish up with this. So, because Sean wants to ask me some questions. Let me just go. So here's what I want to make. This was the whole thing about this. I don't want the vaccine, whether or not, listen, I think the vaccine from my opinion right now, is that it looks pretty safe for most people. I don't know when they talk about outweigh the risks. It's all, that's why I wanted to underline that outweigh in a lot of people like Jeremy, you and I, the vaccine, is outweighed. The benefit of the vaccine is outweighed by its potential risks, in my opinion.
Right. Yeah.
Okay. And I make that decision myself.
Right.
And same thing with you.
Yeah.
Now, is it the same thing in a 5-year-old? I don't know.
Yeah.
And that's a tough one. I really feel bad for the parent. I feel bad for the parents because they don't know what to do, and especially pregnant women. Now CDC just came out to give all sides, and they just did another study saying it doesn't mess around with fertility. And so the studies are coming out, and it may be that
again. As a parent, I'm in this situation again. I thought I escaped it because my son was going to go to New York, and he was going to do a workshop. He does a lot of theater. He's as a
this is a great story. This is what I wanted
to Count Basie, right?
Okay.
So he was going to go, and he was going to have like a thing with the cast of The Lion King in New York on Broadway, a workshop with them. Okay. So they were going to be on the stage. They were going to be meeting the actors, the backstage crew, and all that. He was excited, but he would need vaccinated if he was going to go.
He needs a card. I need a card.
He would need the card and everything like that. So that was something. And we had an argument about it. Like really the first argument in our lives, he's a good boy, but he was telling me how he felt, and I was telling him how I felt. I said, I think you want this because you want a card that'll let you go everywhere you can't right now. I think that's what you're thinking about more than the safety of things and stuff. Because this is what's going through parents' heads. So now, because he's a member of the Thespian Society, National Thespian Society, he just won as best stage manager, and he might have to go out to Indiana, and if he does, he's going to need to be vaccinated again.
Boosted or vaxxed again?
Vaxxed and probably boosted to be able to go.
Oh, did he not go to the New York show?
No, that ended up getting canceled. So I was like, whew, so now I have to go. Me and my wife have to talk about it again, and we don't like taking away opportunities from our son.
Of course not.
Massive opportunities like this. He's already working on his. He wants to be a heart surgeon. He's already working on his academic portfolio is really impressive. So we do not hold him back. If he can go and do something, man, go and do it. So now I think Maggie and I are going to let him get it.
Okay. How old is he, Jeremy?
He's 15, going on 16.
Right. So that's a great thing, because like New York City right now, you can't go into a coffee shop and get a coffee and a sandwich without your card, without a vaccination card. Yeah. So that's another whole layer here. Is it necessary? Is it right? Here's the thing. I want to just make a point about that, because I have family members who had corona. They got antibodies. They didn't get the vaccine, but they're shunned from the family events. They're not allowed to go anywhere. They're like the leopard.
This is happening all over.
All over. This is millions and millions of people. So here's my thing.
This is the saddest thing too, though.
Right. So here's the thing, and I understand, but my question is, does the literature support that now? And what I mean by that is the reason I would imagine they don't want your son going there without a vaccine is that they're afraid he could infect people with corona.
Right.
My question is he more at risk to spread it than somebody who didn't have the vaccine or had the vaccine? Yeah. Now, this last thing with the Omicron, it looks like people were spreading it left and right who were vaccinated.
Especially. So everybody, Christmas time is the time where you're usually going to gather together as a family. There was Thanksgiving also. So all across the country, we were getting situations like this. And Vera, okay, she is against getting the shots. She's super far right, So I don't want. We can't invite Aunt Vera over. I mean, we got the kids to worry about, and she might give us corona, But they tell Aunt Vera it's because we don't want to give her corona, because she's not on the thing. So it's putting families at odds. It's putting them against each other, because it's not always a happy story where it's simply that. Sometimes they're attacking each other. Now we don't like Aunt Vera. The kids are never going to see her. And
Right. She's
and
a leopard. Put her.
yeah.
Let her
So
sit outside.
this is everyday Joe stuff that is happening because of what's going on out
So
there.
think about what you're thinking. So take this to the logical conclusion. Think about it, right? That you're assuming then, or you're making, in my opinion, like if I'm like a Martian, I just came down here,
Yeah.
and you're saying you're not letting her over there because she's not vaccinated. Then I would say to myself, okay, my brain works this way, I'd be like, well, then that means if you're vaccinated, there's no way you could spread it, right?
Yeah.
So is that the case?
Oh, but
is that the case though?
Mike, they don't want to hear that.
No.
talk.
Well, I'm just asking. I don't know the question to that. I don't know the answer to this. So in other words,
I think they know now that if you're vaccinated, you can still transmit coronavirus.
Okay. So then the next question is, why would then you still have that policy? Well, you don't spread it as much.
That's it. That's
okay. Well, what? I mean, 5% less, 10% less, 1%.
It gets worse and worse as long as you don't keep getting boosters every single year.
Well, but that's a different thing now. Yeah, I understand. But so my point is that I am looking for the literature right now that says that I have a 5% less chance of spreading it if I have the booster and the injection. I thought the whole idea about the booster and injection is to protect me, not you.
Yeah, that's the worst part.
No worries. It's my personal choice to take the risk, and I'm not going to go in the hospital.
It should be an individual choice, my individual
right.
responsibility.
Yeah, but that's why the vaccine has been weaponized against each other.
Right.
So you can't feel
well, why
way
like this,
about that.
like up in New York City. I mean, people could walk in there. I would have it like wear a mask. Then say I would have the employees wear a mask, and if you want to go in a coffee shop, wear a mask
or Uber Eats
and a shield. Yeah, or don't go there.
See, that's what the new world has got to be. Bill Maher,
who?
Bill Maher.
Who's that?
The guy that
HBO.
Is that the guy with the patch on his eye and the limp and
no.
The small penis? No, that's not Bill Maher. Okay,
no, you're hanging out. You're hanging out at the wrong bars. No.
I know who. I'm only making a joke. I know who Bill Maher. I like Bill Maher. He's pretty. He's a smart guy.
He is.
But he's an atheist, so I don't. He don't believe in Jesus Christ. But anyway, we're going to convert him. Go ahead. It's okay.
But Bill Maher was saying about what was the topic? I just lost it.
You're talking about sandwich, Corona, and whether or not you could spread if you had the vaccine. That's what we're going on.
Oh yeah. He's
individual.
He's saying like, why can't it just be like, do what you like. If you want to wear a mask, wear a mask. If you don't want to wear a mask, you don't wear a mask, and leave each other the frick alone.
Yeah.
Like, why can't it just be that then?
Why can't it?
Here, listen. I'm going to make.
So then, if you're wearing masks and you're against this, it doesn't friggin' matter to me, and it shouldn't.
Right. That's what I'm making. We're getting
and vice versa.
Here's what's happening. There's one of our very famous, and a lot of people think one of our most I don't know what you might say special presidents was Franklin Delano Roosevelt, and he served I think 4 terms.
Yeah.
And
we talked about this.
So I want to make a point here because this kind of dovetails into this one guy, Robert Malone. He's talking about this like mass hysteria, and when Germany was invading Europe. And, we had Pearl Harbor, and we just came off of 10 years of a depression where, in the Dust Bowl. I mean, you're talking, this country was in bad shape.
Oh, yeah.
It looked like we were never, it looked like the end of the world. And then we had the war.
You want to talk about shortages?
Right.
Holy hell.
And one of the things he got up he did these fireside, the radio chats.
Fireside chats.
There was no TVs back in those days. And he said something that I think we should say now and think about it. He said this, he goes, the only thing we have to fear is fear itself.
Mm-hmm.
Just think about it. Let me make that. The only thing we have to fear is fear itself. We're getting to the point where we're so fearful that we're losing our friggin' minds. That's why he said that. He's like, listen, calm down and just let's do what we got to do.
And I'm also shocked that there was a president that actually talked to his people.
Well, I know, but
they did.
Yeah, they did. But here's the thing, when you fly a plane, like I've been in situations where, there's a problem, something happens, your electronics goes out, something's beeping, the landing gear don't want to go up or down, whatever. So there's an old saying, and that saying is fly the plane. just friggin' fly the plane. You know how many people crash because they're like, ah, bang. They lose their cool.
Right.
I remember one, it was this tragedy where a guy was coming into the airport and another plane was coming in. He was making a bank and the other plane was coming in and he saw him. And all he had to do, he just could have pulled up, but he flipped out, and I guess he thought he was going to crash, and he overreacted, and he crashed the plane and died. My point, and he killed some other people with him. My point is I think we are in this situation where we're not using common sense. Yeah. We're losing our minds.
We're not listening to each other.
Clear.
What's that, Sean?
We're not listening to each other. It's our big thing right now.
No, we're not listening. And they're sanctioning doctors. They're doing all kinds of things. And getting, what started this thing, one of the reasons why I talk about off-label and everything, this was preceded by years of doctor-patient relationship being degraded. And that was one of the Affordable Health Care Act. Although it has some good points, one of the bad points is it eroded. It took away the doctor-patient relationship. That should be succinct. That should be one of those, you don't touch that, like the mother-child bond. The doctor-patient, it should be you and I decide what treatment.
Right.
You want to have some government telling me or you can't have this drug, you can't have this test. That's where we're going.
Because it is a very intimate relationship,
no,
the doctor and his patient. I mean, like getting everything right.
Yeah, that phrase is said a lot, but like people don't realize it should be a years-long relationship between you and one doctor. Yeah,
absolutely.
They should understand you have asthma or whatever you have wrong with you for everything that you come in with.
Absolutely, and that's why, like,
you walk in, the doctor knows you.
5 things already.
Your family.
Yeah. Right.
He's like, he knows everything about you.
And you know what? That's efficient because he doesn't need to order a million tests. Like I'll get somebody who I'm going to operate on. We'll get what's called PATs, and there'll be an abnormal blood work, right? And I'm like, listen, I don't know. I said it could be this, it could be that. You call the primary, or they go do. I said, see your primary, get cleared by the primary doctor. Primary's, oh, he's had that for 10 years. It's nothing. We checked it out. We did this, that, bing. It's fine. So that quick without me ordering another 10 tests. So makes a good point. But the doctor-patient relationship was deteriorated back then. Now they come up here, and this is the first time in my life that I want to bring it, that off-labeling drugs, which is legal, as far as I know, it's practiced legal. It's I just looked at it today, and 1 in 5 drugs are off-labeled, but these 2 drugs are not. These 2 drugs were scoped out, and like you said, there was just another lady. I don't know if she's crazy or not, but she was prescribing it, and and they locked her up. They took her license away. She had to see psychiatrists. I'm not saying to do anything against the law, but
see a psychiatrist.
Well, she was saying stuff, right. There's this right now. This is like these. What's interesting too, they had these Senate hearings, and this is all public now. So they had these doctors there, basically, putting their position on the medications and vaccines and everything. And then you had the president of the United States saying everybody in the United States is going to get vaccinated, and then the whole world. So there's definitely a slap down.
We're about like 83% vaccinated in this country. I got to tell you something. That's no small task.
The only way,
no small undertaking to get that done.
No, and if you look at the people who are 65 and older, it's like 99.9%. We're not stupid. We know.
No, I mean, but that's an achievement, is what I'm saying.
If you want to get 100%, Sean, if you want to get 100%, you're going to have to pass the laws, and then you're going to have penalties. Even today with the drugs, there's a lot of people get exemptions and everything. But I think it's disingenuous to think that you're going to get the whole world inoculated. There's going to be natural immunity. There's going to be therapeutics. My point about this whole thing is that we're emotional. Like you said, we're not listening to each other, and we're getting crazy. And I tell you, I don't know where it's going to go. You see one country, one state doing this, that. Now they get the masks again. Don't have masks. What's the other thing? The distancing.
That's been old. That's old hat now.
Yeah. Like I said, we still wear a mask in the office. We require everybody to wear the mask. Half my patients have the mask hanging down with the nose sticking out.
Yeah. They call that the chin diaper.
Yeah. And then I see people touching the mask and everything. Now here's the other thing too. They're going to give everybody N95s.
The pinch when they pinch it away from their face, so more air can come in.
Right. Well, I can tell you right now, the N95 and N94s, they're tough to breathe, man. We don't wear them in the operating room.
It's tough to breathe in them.
You can't. First of all,
Really?
Oh,
you know
yeah.
the ones that you
I've worn
tie.
one.
No,
Really?
no,
Holy
you
cow.
can't wear them for a long time. You're gonna there for like if you're gonna be grinding a car with like a lot of stuff coming up.
Yeah.
You wear if you really have somebody who's really sick. Say you're worried about whatever.
Max time.
I don't know. It's
wear
hard
one
to
of
breathe.
those.
The best thing really is to have a rebreather where you have a mask that has, like a snorkel and mask with an oxygen tank.
Yeah.
That's probably the
We
best.
should bring back the Black Plague pipe mask things.
Oh yeah,
That's what we should get.
yeah. You
Yeah.
see, that's right. We had that.
Yeah,
Yeah.
yeah.
But they're very hard. Like when I operate, and I've been a surgeon for 30 years. We don't wear an N95. We wear the regular cloth mask, not the ones you see, the blue one I have.
wear
The ones that
are-
the doctor,
yeah,
right?
Yeah.
That you could breathe with them. It stops a lot of the stuff going down. It's not perfect. When we operate, when we do in the hospital, when there's a total joint going in where you want the absolute, best sterility, what you have is you actually put on a hazmat suit with the breathing apparatus, and you actually have plastic. It's like comes down about 2-3 foot from the ceiling around the operating table, and then there's air that's circulated and what's the word I want to use? Filtered. So like right now, let's just say I have a mask on. You're gonna get corona. It's gonna go on the sides. It's gonna go and lay down on the table. It's gonna get aerated, and you might get it. And the way you get any virus is through your eyes, ears, and nose. So anyway, let's end this. I just want everybody.
Well, let's
do Sean.
yeah,
so we
let's
have
do
This
Sean's
is
thing
great
here.
for me. I might.
no. So Sean is what? Tell me what you tell the audience, Sean.
I have
You're in
small-
college. What is this course for? What are you?
This is for my news reporting class. I just have to do a report on a frontline worker who had to deal with COVID at the time. Let me ask you a question that I had written down.
Oh well, I had to deal with it. That's for sure.
Yeah, you did, yeah.
Were your surgeries? Because there was no volunteer surgeries or anything like that, right? So only emergency surgeries during the time.
No elective.
No
No
elective.
elective.
So what happened was they when it all happened, you got to remember there was the state of New Jersey went into a state of emergency, and in fact, the state of New Jersey is still under the state of a medical emergency, and the United States, the whole country went into a state of emergency. So at that point, the governor has sweeping powers, and the governor, through the health, the Secretary of Health in New Jersey, made rules that they passed down, and they made a lot of them.
Mhm.
And one of them is that you can't have any elective surgery in the hospitals.
So
Now-
how much of what you do was you couldn't do prevented from doing because of
probably 80% of it.
80%?
I can still do if I'm on call, an emergency, which I did. I had a 90-year-old guy who fractured his foot and ankle, and I operated on him, and he had COVID. But
How long were elective surgeries not allowed?
I want to say 3 to 4 months, but it was
Wow.
more than that because it was. But when it came back, it was modified. It was
'Cause
modified.
It was like it had to have been about 6 months because that's when
Yeah.
they were going through giving the doctors a stipend to make to
the PPP.
the PPP and all of that. So they were getting something in a consolation prize sort of thing for the work they were losing. Also, payroll. They weren't making payroll for a lot of people, so a lot of people were being laid off during the thing as well. So business was like shut down to a crawl, really.
So to answer your question, Sean, I want to make something talk about the PPP. But so there, I actually know my buddy who does colonoscopies, and he has a colonoscopy center. So they were told to step down to only do a certain amount of cases per week, or a certain amount of days they were allowed to open.
Mhm.
So they weren't completely stopped.
so they had limits.
They had
only.
limits.
Yeah.
And the reason why, coming from the New Jersey government, was that the more cases you do, say, of a colonoscopy, it could be a complication, or you find something that patient has to go to hospital, and then you're going to clog up the hospital. The whole idea in the beginning was to minimize and get the hospital ready and geared towards taking this onslaught of corona patients.
Have as many beds open.
Right. And then if I'm doing elective surgery, I'm not only taking resources, IV, gloves, masks, which we didn't have a lot of.
Yeah.
We didn't have enough. That's another thing. We were running out. I had to beg to get a mask just to treat my own patients in my office. They were doling them out. We couldn't order them. There was, and, in fact, not too long ago, still couldn't get masks, shields.
You didn't tell me all that.
Did you?
Oh yeah, we couldn't get them. We
Yeah,
couldn't.
that
No,
would've
nobody
been-
could get them. My buddy, Wayne, my buddy of mine, who's down in Florida, happened to have about 195 masks
Yeah,
that
were
he
you
had from
required to have the N95 in your
no,
office?
no. But he had him because he does restoration of cars, and he gets them to grind the cars.
Mhm.
So he had them laying around, and I got them. Thank God, because I didn't have anything, and I gave them to a bunch of my doctors in the hospital because they were using a mask like for a week long.
And no one knew at this time what was happening.
We didn't know there was no vaccine.
Yeah, there was no
No.
idea how long that was gonna last.
Yeah, it was scary
No.
times.
Like every day was completely different. Like there was different challenges. There was different mandates you had to make sure was
Rumors
right.
of like what is and what isn't happening, what is good.
So
Yeah.
they shut us down. Again, it was very hard to get masks. And what they did, just so you know, when they shut us down, what they said is this. This is interesting because this kind of dovetails with what Jeremy's saying. The state of New Jersey and the federal government said, listen, we don't want you to fire your staff because if you fire them, or lay them off, they're going to go collect unemployment.
Yeah.
And it's going to jam the system up. So what they said is listen, you keep paying your people, keep your office open, even though you have no patients, and we'll give you money down the road, which is called the PPP program.
Mhm.
Okay. And so I didn't pay, I paid my staff out of my own pocket for, 3, 4, 5 months. And of course I wasn't making any money either.
Yeah,
and then
what they give you is nowhere near what you'd be making otherwise.
Well, no, let me well, yes and no, but yeah, but here's the thing. I don't want to. I think it was a good program. What they gave you initially, it was a loan. It was what they wanted to do. We did it, Jeremy, is that you had to show what the salaries were. So what you had coming in per month. And they would give you, you'd multiply it by how many weeks, and they'd give you a certain chunk of money. And then and ultimately they forgave it all. So it was definitely helped us. And some doctors in some places, they just laid everybody off, and then they, when it came back, they hired everybody back on. But so there was they stopped everything. And then when they started bringing it back, I had to submit a form for an elective case, and somebody would decide at the hospital if it was warranted, or if we had enough resources. Now we're back right now, just so you know, there's no surgeries right now.
You still can do elective?
No, it started. We did cases all summer long, everything. Just this last Corona spike, I have been in the OR, I think 3 weeks now.
Wow.
We got patients lined up. So we're waiting patiently. Hopefully.
Yeah, I didn't know that either. You should,
no, I told you they shut us down. Remember you talked about it. We talked about it. I told you they shut us down.
But you were telling me you were going into the hospital. The hospitals were packed. And
I remember. You go look at our archive. I said to you, they just shut us down. We got memos in both hospitals, Jersey Shore. So we can't do elective case now. Now the surgery centers. That I don't know if this is from the state mandating this or the hospital, because the hospital is really having a hard time with staffing. Yeah. So this might have been a hospital issue and not mandated from this New Jersey government. I don't know that.
But either way, like, it's still
first time was the government.
Whether it's financial or government, like, it's still an issue happening and affecting people, your patients.
Think about this, Sean. A lot of people are not getting colonoscopies. They're not getting elective surgeries. Let's just say they have a blown out knee and they're suffering in pain.
And the crazy thing is, getting the vaccine is an elective surgery. That's what it's considered that.
Yeah.
So elective procedures, we'll say, because you can't even get a shot or an epidural. Well, because I work with Dr.
Did they shut him down, or is he still working?
He's still working, and his surgery center is wide open.
Right. Yeah. See, so it's not a state. Now the surgery center, Dr. Jasper's, they were shut down because it was a state mandate. You say, well, why do they care about a surgery center? It's not the hospital. Yeah. Because the cases he does there, it could be a complication, or somebody might need to be hospitalized afterwards, and you want to minimize that. Now, is that a real risk or perceived risk? In my opinion, I think that was overkill.
And it's also an unlikely risk, because we've had no issue like that at all. But that's what I was trying to tell you.
Fear.
But that's what I was
Fear
telling
is the
you
mind killer.
earlier. Yeah, that's
Yeah.
it.
What else? So what else?
But that's what I was trying to. That's what I was telling you earlier, where every day was a challenge, and that's what it was. Because I had him, I had Dr. Schneider, I had Dr. Jasper, and his ambulatory surgical center. So and we had to keep business going. I mean, it doesn't stop because of fear or mandates or shutdowns and stuff like that. These people, we have patients that are suffering pain. Now, the powers that be may consider that an elective thing, but if you're suffering pain, and I've suffered pain that I hope you never experience in your life, 24/7 pain.
There's
Okay,
people going through that now that probably can't get anything done.
right,
Yeah.
right,
Well, look at that guy Meatloaf. You know the guy who just died.
and that's a
Oh
heartbreak.
my God, he was
Bad
suffering.
out of hell himself, man.
Yeah.
Give me a break.
What's interesting about what Jeremy's saying is that there's somebody, I can't remember now, who is pretty vocal out there about the downside. I think it's Dr. McCullough. They wrote some. They've been researching since day one of not the effects of corona, but not the disease itself, but the lockdowns and the lack of surgery, the lack of testing, and the suicides, the overdoses of drugs, and all of that. The societal effect that's going to be coming out, eventually too, of what this did. Now, could have been prevented. I don't know, but the point is that there's always a social toll to be taken. And, right now, again, I can't be doing elective surgery. So, do I have anybody who, I mean, they could wait.
No, but likely, but you don't know. See, and they don't know.
Pain.
That's the problem. If somebody has a wound on their leg that could be cancerous, that could be something else, or could fester and stuff.
Well,
I mean,
right.
you're limited. You're limited to what you can do now.
And one of the things that is a problem is this. Number one is that, again, it's policy. If you're a nurse at a hospital and say, this was in August, saying you're pregnant, you're 20-something years old, and you had corona, right? You had corona. Yeah. You worked on the corona floor. You took care of corona patients. You watched them die. You watched them live. You know exactly what's going on. Now you had corona. Now it's August, and hospitals are saying, listen, by October, if you don't get a shot, you're fired. So a lot of them said, see you later.
Yeah.
And I know I talk to these nurses.
They're calling this the Great Resignation. Have you heard this?
Yeah.
I've heard people blame it on the fact that they're making them go back to work with Omicron existing.
Well, that's another thing. Yeah. Well,
no, but I'm saying like both sides of the echo chamber, they're hearing something else for another reason. We're just not. None of us are talking.
Right, and that's very true because it's just like what that reminds me of, that argument. It was both sides. When I was a young kid, when I was 18 years old, right? Before, drinking age was always like 21. Everything was 21, but you could go to war and get drafted at 18. So now you have kids getting killed at 18. Mm-hmm. And so they're like, why can't I have a friggin' drink? Yeah. So they passed laws to drinking age 18. Okay.
Yeah.
And then because the environment was so bad, people were getting killed. Then after the war was over, a few years later, things are mellowing out. And then they started passing laws, and they creeped it up to 21. And then they got to the point where if you're 21, if you're 20 years old, you and your girlfriend or boyfriend are sitting at a outside dock somewhere having a bottle of wine, they wanted to put you in, felony charge and put you in jail. So it's
old enough to get married, not old enough to drink.
Right. So what you're pointing out, Sean, is a very interesting thing. It's we decide on things based on emotion and fear. Like right now, when we first had corona, nobody said, Kachmar, don't come in. I would be exposed to corona one day working on a patient, sure, and then have to come back the next day. Who's going to treat these patients? There's not a row of doctors now, right? No. So now, the same thing's happening. But now I'm vaccinated. I have this and that. And if I do get corona, who's going to treat the patient? So we could all sit home. But in World War I, right? World War I, right? We went to war with Germany and was it France? But Germany, and the influenza virus was ripping across this country, and it was killing mostly 20 and 30-year-olds. Do you think they gave a rat's ass? They put these kids in big encampments in the middle of the winter. They put them on ships. I mean, a lot of the kids who died in World War I were from the flu, from the 1918 flu vaccine, the H1N1. So you do what you got to do when the time's around. Like right now, people are going to die if healthcare workers don't go in there and they're still maybe sick or they're feeling better. We never did that for the flu. If you had the flu,
Are they hiring back any of these nurses?
well, they're trying. Now they got to. But my point is that it's fear, it's craziness, and we lost common sense. That's a big thing.
There you go.
Common
That's it.
sense.
Yeah.
So yeah. So like, I mean, like my aunt. My aunt is a leopard. She's not allowed to go anywhere because she had
so
corona.
To speak, a leopard.
Yeah, she had corona. She doesn't want to get the vaccine. You say, well, why don't you want to get it? Because I guess a couple of her doctors told her not that she doesn't need it.
Yeah.
So again, are they right or wrong? She's got antibodies out the butt. But my point is that her family sends her nasty texts. She sent them to me. I mean, they called her like nasty names. I'm like, what? So
it's like turning one side against the
Right,
other,
right.
Getting into the families, turning them against each other.
So what other questions you got, Sean? So
That's the most of them. Most of it you already answered just talking.
it's I think from a doctor standpoint, what I've seen is that there's the American public got dragged into medicine, and
now everyone's a doctor.
Well, here's the thing: if you put 10 doctors in a room and ask them for a diagnosis and a treatment protocol, you're going to get 10 different answers.
Yeah.
That's just the nature of the animal. So I like when I saw because think about Fauci. You say you like him or don't like him. In the beginning, no masks. In the beginning, this is nothing to worry about. Yeah, he's on tape.
Never, man. We couldn't possibly mandate
Right.
anything.
Then it's two
That's
masks.
what he would say.
But it's all of them. But I mean, a lot.
Now it's like
Right.
drag them away. Drag them
ones
away.
don't work.
Right.
Yeah.
But it's not just him. I want to say because a lot of people hate him, but it's the medical profession. We go back and forth. It might be politics. It might not. We're
Bringing it full circle. Like we don't know. The meteorologist is telling us it's going to be 30 inches of snow this weekend. There's, who knows what's going to happen.
I remember once where New York City was shut down.
Weatherman Burger.
Yeah.
New York City was shut down one Monday. I remember this. The biggest financial city in the world was shut down, and it was just like light drizzle. They said it was going to be like 10. They start 3 foot of snow, then it went to 2 foot of snow, then 1 foot of snow, then 6 inches, and then it was nothing. It was just rain. And so you had a whole city shut down, right? And billions of dollars not being moved around because of a bad forecast. But fear, fear. So remember, Franklin Delano Roosevelt. The only thing
you could say Rosa Parks.
No, the only thing you have, the only
thing to fear
is fear itself. The only thing to fear is fear itself. But anyway, I want to close this up because I think it's what is we, Jeremy?
Yeah, we're over, man.
Yeah.
That's
So a couple things with the vaccine. We always tell everybody we're going to be consistent with this because I want to make sure nobody gets the wrong impression.
And please also understand this is the beginning of your research, not the end. Okay. So what you hear on this show, what we talk about, this is where you start, then move on. We are like a buffet. You take what you want and then you leave the rest.
Right. I think that where a lot of people have a hard time right now is the young kids and the parents. And I feel for you, Jeremy.
So tough.
I think also I feel bad for these businesses where, like in New York City, can you imagine owning a sub shop or a sandwich shop and you can't have people go up there without a card?
Falafel on the corner.
There's not people not going to go to New York City. They're not going anywhere.
Yeah.
There's still in these countries where you want to go on vacation, you got to jump through a million hoops to get in there. I'm hoping. My hope is that this Omicron blew through the world and a lot of people got immunity and hopefully it won't, it'll die out. I don't know that for sure. I have no idea, but I'm hoping. I'm praying. I'm praying.
Mike.
And I'm hoping that we have enough people out there who calm down and work on therapeutics and really get this stuff out there and lighten up a little bit and let the doctors treat the patients that need to be treated, and that we have a good discourse and try to get through this because we're hurting and we got to. This is a rough winter, and I think what I'm going to be concerned about is if there's going to be a spike next year. And I think what I'm thinking, what I read is that it's probably going to be where you get a vaccine every year. You get the flu shot with the corona shot, same thing. It's all mixed together, one shot, and kind of protects you. And then you figure another year or two, they should have really good studies on whether or not it affects children or fertility or any of that. And then everybody could relax. They should. But even today, Sean, you talk about the autism and the regular shots. Just people fighting that,
Yeah,
or,
people already don't like shots.
yeah, I'll give you one other example. I don't want, I can keep on going on.
Well, that's
Back-
why people took the Johnson and Johnson one, because it was only one shot. That was
And
fear,
that one turned out to be the worst. one.
right? But it was fear that dictated that response.
Yeah.
So they all ran to it. One shot, okay, I'll do that. Two shots, no.
Yeah, but it was also convenience. People are lazy too.
Yeah,
True.
yeah.
But and it was compliance. But here's the thing: back in the day, back in the 80s, 90s, they came out with breast implants. Okay, and the breast implants, they had silicone, which is kind of like a drippy white, it's like a white honey.
Yes, Mike,
Right?
we know them well.
Right. And I'm telling you right now, I've helped one of my, Dr. Rosen, he was a plastic surgeon. He is still a plastic surgeon. I helped him on a lot of cases, and the silicone were the best. So what happened is over years, they started to leak. Some of them were leaks, especially, some would bust open, but some, I guess rough sex, whatever. But
some women were trying to break the record on how big they got.
Yeah, but
but that's a lot of strain. It's a lot of weight, and the bags that the silicone were in. I mean, you're pushing that to the limit.
Right. So,
aren't you?
but what happened is, here's the thing: they would bust, right? And what would happen is, Sean, some of these women would get this allergic reaction, and they would get chronic arthritis, and this was the allegation. Okay, so the company was Dow Corning. Billion-dollar company. The business was, I don't know how many billions of dollars in breast implants. Every girl and woman, everybody was getting breast implants. I'm telling you, everybody. It was like your 18-year-old girl for her 18-year-old birthday or 16-year-old birthday, they get breast implants. Okay, so what happened was they started to see, and these lawsuits started to come up saying these breast implants caused me to have all this arthritis and all this happy horse shit.
Side effects.
Side effects. You would have actually rheumatologists who would suck these patients up and, oh yeah, it's the breast implant, and this is what caused it, multi-million-dollar, awards. Okay, that's start probably in the 80s, right? 80s. So now we're 30 years.
Yeah. So wait. So it went from silicon to saline, I think.
Right, but So now, but here, 30 years. But follow my point here. 30 years now, maybe more, of evaluation, studies, thousands of studies upon studies upon study upon study. You know what they came out with?
What?
Today, no cause of relationship. But it's still so right. That literature about maybe 5, 6, 7 years ago, I might be wrong in time. So some of the doctors started doing silicone implants again. Same shit. They had to shut it down. They couldn't do it because there was, allegations. There was not one. I mean, I'd have to look at the literature, but I could bring on his place here. But what I remember, there's very, very few. Maybe 5% of the studies showed that there may be a causal. But here's the thing:
so many reasons, eugenics, anything. You treat
but,
yourself.
But what I'm saying is, you'll never know if this vaccine is truly 100% safe.
Yeah.
Because just go back to the whiteboard. I go out here, determined to provide benefits that outweigh its known and potential risk. Right. And that's even known is a tough one. What about the unknown ones? You see there, the two things there that I want you to blow your mind on is outweigh and known. Yeah. What do you mean outweigh? What does outweigh mean? And what does known mean? So my point is that, we're arguing over bullshit. I could definitely tell you that the vaccine works. We've seen a lot more people who got vaccinated didn't die and didn't get, hospitalized. We definitely know it works, number one. Number two, how much it works. The other thing is, I know it works because I got antibodies after I got the vaccine. So question is, the safety we'll know to a certain degree in next year or so. Yeah. And hopefully also you want to have some therapeutics. And are the therapeutics 100%? No. But, so you spin around and then you sit there and you go, what? I feel, again, bad for the parents who have to make a decision. But I think, again, maybe another 6 months, maybe hopefully by next September, we'll have maybe more solid studies. And when you look at studies, Sean, when I was doing my med school, I'd look at 10 studies and I would always say to myself, what's the preponderance of studies? What's their
what do they want to get out of this?
No. What are they saying is the best?
Okay.
There might be 3 that are like crazy. I always try to go with what the general theme is. You'll never see, if you live in a black and white world, you're done. So we'll never know 100%, but what we will know is the preponderance of evidence. It's like a jury, is there a preponderance of evidence? Beyond a reasonable doubt. So I want to get to the point where we're beyond a reasonable doubt that the vaccine is harmful, that it's not, that it's safe, beyond a reasonable doubt.
Mhm.
So are we close to that? I don't know. Hopefully, that's, see what I'm saying? That's the way to look at it. And that's how we as human beings work.
But I feel like that is the question people are really asking when they say, is the vaccine safe? It's what you just said.
The
there.
preponderance
That's
of evidence.
That's
Is
what
the
they really want to know.
Right. Because there's going to be
Because
evidence.
they're not going to be happy otherwise.
No, there's always going to be evidence that it's not good, it's bad, right?
Yeah.
It's and what sometimes that gets flamed by the politics.
That was an amazing way to put it, Mike.
So it's
Yeah.
preponderance of evidence.
Yes.
We could have a mock court next. We should have 6 people in
We
here.
should.
That one show is called 12 Angry Men.
Yeah.
We should have that 12 Angry Men.
One of my favorite movies, man.
And we could talk about, as the one who's going to go to jail or can get convicted
Yeah.
is the vaccine. The vaccine's on trial.
And everyone's gonna agree. Everyone's gonna disagree. Everyone's gonna.
But yeah,
fight.
well, I don't know. And it's you could but I just watched that, by the way. That's a great.
I just
Good
watched
movie.
it too.
You know what you got to do?
Isn't that funny?
You got to watch both though. Do you like the old one or the new one?
I've only seen the old one.
I'm a big fan of George C. Scott. So I like the
he's
new
great
one.
in there.
Oh, he's
But
fantastic.
did they change the words at all? Or is it all the same? I don't
might have
remember.
been changed. I haven't seen the new one recently. I saw the old one recently.
Who's the guy? Danson?
Tony Danza.
He's friggin' on fire on there. I tell you what,
wasn't Jack
George
Lemmon-
Scott,
wasn't Jack Lemmon in
the
it?
first one.
No,
No,
he
the
wasn't
second
in-
one.
Yeah, he was in
yeah.
the second one.
Yeah. Scott. What's his name? What's his full name?
George C. Scott.
Friggin'
He's
The
unbelievable.
black and white one.
No,
I've
the
only
new
seen
one.
the black
Color
and
one.
white one.
George C. Scott is one of my favorite actors. He died it was a tragedy losing that man. He was fantastic. If you want to watch a fantastic movie, Exorcist 3, okay? He plays the cop, which ironically, the guy he plays in the new version of 12 Angry Men, the actor who played his other one in the black and white played the officer in the original Exorcist, and
That's
he
weird.
reprised his role.
Right.
Yeah,
I like
it was
him.
weird,
The best.
right?
The best show I liked him in was what's the one with Peter Seller?
That's Dr.
Strangelove.
Strangelove.
He's great in there. But let me get back to that that movie, the second one.
Yeah.
The 2 actors in there. You got to watch this. Powerful. There was
gotta watch the new
the
one
guy.
again.
Who was the black guy who played? He was like a Muslim. He was like he got the hat. He was unbelievable. He was one of the last holdouts. But he started going. He played the character who was about those people because he was black. But the guy who's on trial was Puerto Rican. But I mean, you got to watch that.
I haven't seen, I've
watch
not
the
seen
new one. I can't think. Who's his name? Who's the actor? Friggin', just you get things on the back of your neck. But anyway.
Right,
So he's going to find out. So Sean, listen, thank you. You're going to be here next week for the lifeguards off duty.
Hopefully.
Hopefully.
Actually, we're gonna do it online, I think, right?
Oh, that's right. You guys are going to be away. So that'll be good. Jeremy's looking up something. Listen, everybody, I'm just going to give you the, if you want to get a hold of us.
Jack Klugman was in the original.
Yes, Jack Klugman.
Yeah, Jack Klugman and Jack Warden, who I'm a huge fan of. But Lee J. Cobb played the angriest man.
So what we're going to recommend out there as an aside, what you do is just tomorrow, right? It's going to be snowing. Everybody's going to be in the Northeast. Is going to be locked up in their houses. So here's what you do.
Binge watch both.
But you got to watch both.
You got to watch both.
Back to back. Then tell me that's and it's, you know what it is? There's no special effects.
No.
There's no
It
cursing.
takes place in one room.
One
room only.
One room, and it's friggin' great.
Amazing.
And you can
You
watch.
don't see the trial. You
No.
only see the jury making up their mind.
But you can see in your mind.
Oh yeah.
You could see
They
in your mind the
tried
whole
so
friggin'
perfectly.
thing.
Yeah,
it's good.
That's why I love reading books because when I used to read, I could see the word. That's why literature is so good. That's why when you could watch a movie. but you, to
Then
read
reading the
something,
book and
to
seeing the
read something, it
differences.
puts you in a
It
different plane.
slows it down so much.
Yeah,
Yes,
I'm
it does, to
yeah.
your pace.
I'm
yeah.
I just download audiobooks. I'm gonna Victor Davis Hanson. It's called The American Citizen. Can't wait to key it up,
Oh
man.
wow,
It's
cool.
like 15 hours. I just finished another. Anyway, Jeremy, can you throw the stuff up there for everybody?
Yeah.
So you want to get a hold of this? It's Dr. Kachmar. That's Kachmar at iCloud.com.
That's right.
That's our email address. Shoot us a note, a message. If you didn't agree with us or you want to comment, if I said something wrong or
Yeah,
off color, like I said, I'm a foot and ankle surgeon. I'm not an epidemiologist. We don't know nothing. Jeremy even knows less than I do.
Tyler texted us. He says, "I thought this was a medical show."
It is. Yeah. So the other place to get a hold of us is Jersey Shore Foot and Leg Center.com.
That's right, sir.
And you could
And on Facebook and on YouTube, the visual aspect of our
Yes.
shows, please subscribe now and press on Facebook, YouTube, press that bell notification.
subscribe.
And subscribe, yeah.
Subscribe
So
to
you'll
us.
always know when we're doing the live show.
Subscribe to us. So Jeremy, I'm going to put the little music on here. So hang on. So I don't know which one we get. We're going to do the other music. Hang on. We're going to, because
The better music.
the better music.
Yeah.
Intro music. Here it is right here. So we got it there. So we're going to start putting this music on. So listen, everyone. Yeah. So don't not, so listen, we had a great time today. We had the beautiful, great guests, and Jeremy, like always, Jeremy and I spar a little bit, but it's all good.
It's all good. And what I like to say at the end of our shows is, please,
Go ahead, Jeremy.
everybody, be kind to each other. That's the important thing. It's the one thing that never got any more expensive. It's free. Be kind to each other, because you can make somebody's day.
And Sean, you said, what are we not doing?
We need to communicate more.
Yeah.
Right. We need to speak to each other.
Listen. Actually, here's a rhyme. There once was an owl that lived in an oak. The more he saw, the less he spoke. The less he spoke, the more he heard. Why can't we all be like that wise old bird?
There you go. I like
There you
that. I
go.
like that. And listen, remember, and this is not I didn't have this. This is from a great, great man, Franklin Delano Roosevelt. God bless his soul. The only thing we have to fear is fear itself.
That's right, sir.
Okay. So, and that's something that we all need to think about. All right, everyone. Listen, we'll see you guys next week.
Take
All right,
care.
Jeremy, send us out.